I'm Dr. Fred Southard, a chiropractor in Hamilton. Today's short video is going to be on spinal decompression with the DRX 9000 machine. Probably today is one of the worst days that I could have picked to shoot a video about DRX 9000, and the reason it's one of the worst days is that this morning before patients even started arriving, I received a phone call from one of our patients who informed me that she is scheduled to have surgery on her low back tomorrow. For a chiropractor, that's not a good thing. Why is it not a good thing? Well, my very first patient I saw this morning was a gentleman who's had 3 surgeries on his lower back already. My first patient after lunch today is a lady who's had 4 surgeries on her neck. Shortly after that lady is another gentleman. He's had either 3 or 4 surgeries, I'm not sure which, on his lower back, and we're fighting and doing everything we can to keep him away from another surgery on his lower back. If the surgery were the answer, boy, would I be so happy to recommend to everybody with lower back problems, go get surgery, it'll work, it'll work. If it works so well, why is it today? And this is not even looking at the rest of my patient load. This is just looking very briefly at this morning's patients and a couple of patients this afternoon. Why is it they've had to have 3 and 4 surgeries on their back if it works so well? Another question I get asked sometimes is, why did you spend all the money for a spinal decompression machine? This is a spinal decompression machine that I have in my office right here, the DRX 9000. It gets incredible results. A study by John Leslie, a medical doctor with the Mayo Clinic, he reported to the anesthesiologist, I think it was a group in September or October of 2008, an 88.9% success rate with people who went on decompression. That's an incredible success rate. And when you get into the world of low backs and you get into the world of surgeries, it's not a pleasant place to be. I bought a spinal decompression machine because of the statistics that were out there. And I can tell you, it is not uncommon for people that we see who have a first surgery to have a second surgery. Once they've had a second surgery, it's not uncommon to have a third surgery. And the most surgeries I've seen is one guy came through several years ago. He had either 7 or 9 surgeries on his back. Again, maybe the surgeon made a mistake on the first one. Okay, we corrected on the second surgery. Well, surely we correct on the second surgery. Why a third surgery? Why a 4th surgery? Why a 5th surgery? Why on and on and on and on and on? My plea to people today, the statistics are in on the decompression machine. We have them here. If you're interested in decompression, contact my office. We will be more than happy to send you a free report and a little CD that you can play, a video thing that you can play on your computer or on your DVR machine or whatever the things are called. You see about the results. These are documented results. If spinal decompression wouldn't work, then you can have the surgery. And there are people, each of the 3 people I've mentioned today I'm seeing or have already seen, every one of their cases, the surgery was definitely indicated before they had the surgery. But unfortunately, it put them into a world where they had a second surgery, a third surgery, and on and on and on and on and on and on. Decompression, it works. And if you try it before you have the surgery, if it doesn't work, then you can have the surgery. But if it works, you avoided entering that world of surgeries, and it's a place where you don't want to be. If you have questions, you can contact our office at 513-868-0978. We'll be happy to send you a free report, or we will be glad to talk to you on the phone. Thank you for watching this short video.